Hello, everyone, and welcome to the June 2025 episode of Ask Mary Pat. Today is going to be short and sweet and a little bit of a public service announcement. I'm going to talk about an experience that I had that is applicable to you potentially, and also it's applicable to our animal friends as well. Disclaimer that I am not a veterinarian and I'm not a medical professional, as in a doctor or nurse or technician or anything like that. And nothing I say in this video or any of the other videos can be used in exchange for medical or veterinarian advice. Today, I want to talk about We Are Not a Bag of Bones. In 1997, I actually tore my knee very badly in sports. I tore the ACL in half and put what they call a bucket handle, like a bucket handle, tear in my meniscus and just really tore it up good. So I ended up having surgery and they took a piece of my patella tendon to replace my ACL and then fixed the cartilage to the best that they could. Cartilage has your meniscus has zones that get a little bit more blood flow, some get a little bit less, and so depending on where the tear is, you can have greater healing or a little bit the healing may not be quite as complete. So, and that's what happened with me in some areas, and I had several scopes afterwards and then went on about my merry way. So, like I said, this was 1997 when all this happened. I think my last scope was probably 2001 or 2002 or something like that. And I knew that over time, because of the cartilage damage and the overall damage, that even with the surgery, that there was probably going to be some arthritis forming later on. Well, now I'm in my 60s and it started catching up with me a little bit. And at the beginning of this year, I think it was January, end of January, I think. And I had been at the gym and I was working out and doing some leg presses. And when I got home later, my knee blew up. I mean, it blew up a lot. And the next day it was really blown up and it was super sore and different areas, but a lot of it on the medial side, on the inside of the leg. And I was like, wow, this probably isn't good. And I thought, with the damage that was done, and now we're talking, 30, almost 30 years later, I thought I'd go ahead and go get it looked at and see where it is at this point in time. So mainly for information, just so I know what maybe I could continue doing and what do I need to modify and what shouldn't I do at all. So I went to an orthopedist that came highly recommended, and I had seen him one other time before for a minor ankle thing, mainly wanting to make sure I didn't have a stress fracture in my ankle. And really nice. I really liked him a lot. And so I went back to him and they took x-rays, of course, because that's what they do. It's same with your dogs and whatever. We take x-rays, okay? It makes total sense to do that. Let's rule out anything that can be shown up on an x-ray. So took the x-rays, and when I was in the room with him, and he knows that I know a little bit about stuff, and he pointed to the x-ray and I went, wow, that's not good. It was not all the way, mostly on the medial side. It was bone on bone. And so he said, you need a new knee. And I said, he said, this is endgame. That's not the beginnings of osteoarthritis, which is also, I'll refer to it as OA from now on. It's not the beginnings of OA. It's not, you're not partway down. This is endgame. And I went, okay. And he said, you need a new knee. And I was like, yeah, no. For a couple of reasons. I mean, I make my own decisions. I go to the medical professionals because they are the experts in their field. But it is my body. And so I am gonna, and same with my dog and my cat, and if I had a horse, same thing. I'm gonna make certain decisions based on the information that I get. Um, Couple things, there was no way that I can't afford. I can't afford to have a knee replaced, and I can't afford to be out of work for that length of time. And I didn't really feel like I was there. I really, really, really didn't feel like I was there. And I also had some of you know that I do a cycling challenge every year. It's about 110 miles over 2 days, benefits wounded veterans, and wounded veterans participate in it. It's a big deal for me. And my girl Tara is one of the top, has been in the top 5 fundraisers all 6 years we've done it. She's kind of become the mascot for the whole event. I didn't want to miss it. And I just didn't feel like I was there. I could get around. I look at other options. But I took his information and I told him about the cycling challenge and, we talked about the possibility of injections and I left. And I guess it was a couple weeks later that I called back and put a message back to him to say, hey, what about an MRI? Is it possible, that there might be some damage that maybe is something he could, like I'd had my shoulder done last year, had it scoped. It made all the difference in the world. I couldn't do all the repairs that they felt that I needed. I wasn't going to do a shoulder replacement, but it made a big, big difference with what he did do. And so I thought, well, let's check. Okay. And the answer I came back was, no, your OA is too far advanced. It wouldn't do any good at all. I went, okay. Well, that's kind of a bummer. And then I already had an appointment with an osteopath that I see for, I had originally seen him with my shoulder prior to the surgery to see what else he could do, not just from an osteopathic manipulative treatment perspective, but because he's a sports medicine specialist who is part of a group called Regenerative Orthopedic Sports Medicine in the area where I live and in DC and places like that. So he specializes in ultrasound. He specializes in ultrasound guided injections and plus his osteopathic, his OMT. So I thought, worth going to see him since he really helped me with my shoulder last year. And he had said to me, when he looked at the MRI for my shoulder last year, he said, here's what I can do, and I'm going to go ahead and ultrasound it. And he found stuff, he found additional stuff. Um, he acknowledged he couldn't see some of the things that the MRI, could see. I understood that. But he also told me back then last year, he goes, you're going to have to go get this stuff cleaned out before I can really, really help you with this. He said, go get the scope. I said, great, wanted to know that. So I had already made the decision I already had an appointment with him and I called and I said, can we switch this from general OMT to have him look at my knee? Um, so that's what we did. And he did an ultrasound on my knee. Basically, there was stuff that he did find, and it was soft tissue nerve damage. Not nerve damage, it was a nerve impingement. And actually, he did I think they call it a hydrodissection, which actually released the nerve from the surrounding fibrosis. It was actually amazing. Um, So he did ultrasound guided injections of Serapine, which is a derivative of a pitcher plant, and it's highly anti-inflammatory, helps promote healing. And then I forget the name of the drug, but it's kind of like a liquid Motrin, and mainly to help with the healing, but also to help with the level of inflammation and pain, because my cycling challenge was going to be 2 weeks later, and it did. It made so much difference. I can't even begin to tell you how much difference it made. Did it change the osteoarthritis in my knee? Is it going to make that better? No, it's not. It's not going to make that better. I understand that at some point I may need a knee replacement, but for me, A, like I said, I can't afford to be out of work that length of time. B, it's just my personal choice. I don't want fake joints in my body until I can't get up off the floor. If I have to call people like 3 times in a row to help get me off the floor, okay, then I'll go do it. But it's a personal choice for me. And there's all sorts of things, reasons for doing it sooner because you're healthier, you'll recover quicker. And I understand all that because I get this stuff and I make my choices, not just willy-nilly. I really think through them. If I have to do a knee replacement 5 years down the line, yeah, I'm going to be a little bit older. Maybe it'll take me a little bit longer to heal. Maybe they'll come up with a whole new thing that they could do in those 5 years that's going to be significantly less invasive. You just don't know. So you make your decisions based on the information that you have at the time, and as that information may change over time, then you can modify your decision or not. The point of this was the whole we're not a bag of bones. And what happened was I fortunately know enough in this area. I don't know, if it was a cardiac issue, nope, don't know enough about it. I'd have to go with whatever the doctor says, or I could get a second opinion, which by the way is what I did do with my shoulder. Last year, I had a person who was going to do it. I knew enough to ask what the orders said. And there were four things that this doctor was going to do. And I said, okay. But then one of them was to cut the long head of the bicep tendon. And I just wasn't sure I wanted that done. I wanted to have a meeting with him before proceeding to say, why? Why do we explain to me again why we need to do this? Why do we have to do this? And what are the what are the implications if we don't cut this tendon? What are the implications? And the implications were, really that you just maybe not get rid of all the pain. And I'm going, okay, I think I'd rather keep that long head of my bicep intact and suffer a little bit more pain for me, personal choice, because I'd rather have it intact. I like redundant systems. I really like them in the body. Yes, you have another tendon, you have the short head tendon for the bicep. What happens if something happens to that? Then I have no bicep. Okay. So not as likely, lower probability, et cetera, et cetera. You got to think through all of these things. And when he couldn't convince me otherwise that it was an absolute necessity, everything else he was going to be doing was going to get rid of a lot of the pain. So I was willing to take that chance. And then when the next morning, when she called to schedule the surgery, and I said, can you please read me the orders? And I always get, well, I can read them to you, but I can't understand them. And I said, that's okay, because I probably can. And she did. And out of the four, there were only two left. There were only two things left. He was only supposed to remove one, which was the tenotomy, which was cutting the tendon. And the work that he was going to do on the labrum, which was macerated, had gone away. And what it turned out was that he said there was no point to him doing anything with the labrum because the long head of the bicep wasn't going to be cut. And that just didn't, I was like, we didn't talk about that. I wasn't sure that that was true. I'm not a surgeon. I don't know, but I knew enough to say, I knew enough about the body and anatomy and everything and kinesiology to say, I wonder. And I went to get a second opinion and actually went with that surgeon. And that surgeon's fabulous. He was fabulous. So I was really, really glad that I asked the questions. Now, not everybody's going to know to ask those questions. So that's why I'm doing this, is to give this little bit of a public service announcement to say it's okay to ask the questions. Um, if I didn't know enough about soft tissue, if I was in a financial situation with my work and everything to be able to have the knee replacement, I would have listened to that first ortho and said, okay, give me a total knee. And I'm sure it would have gone well and it would have been fine. But I don't need it right now. There was soft tissue damage that needed to be addressed. And getting that addressed has made all the difference in the world for me as far as my level of pain and what my knee can tolerate. So I actually, in my opinion, I don't need that full knee replacement. And the osteo, who did the ultrasound and everything else for me said, yeah, you're probably going to need something at some point, need a replacement. And he said, but looking at your knee, you might want to go with someone who does a partial knee replacement because I think you could be a good candidate for that. I didn't even know such a thing existed. And I was a little upset to find out that that existed and it wasn't an option that was mentioned by the other ortho. Now, maybe it's because they're not as successful. I don't know. I'm not going down that path right now, so I'm not going to do my own research. Um, it may be that he doesn't offer it because he doesn't do them. And I don't, I guess the reason I'm saying all of this stuff is because it was concerning to me that there are going to be people who go, oh, I need a knee replacement and not pursue it any further. So all of this is simply to say, we're not a bag of bones. And neither, however you say it. What's that song? Neither is your dog or your cat or your horse, okay? None of us are a bag of bones. There's a whole lot of soft tissue involved. And we're not a bag of bones and just organs. There's a lot of soft tissue involved. And, you've got not just the muscles, the tendons, the ligaments, the fascia. Anything can be an issue in any of those areas that could be more of a major cause of pain. Okay, so it's worth exploring that as a potential cause of pain and looking at the damage because you want that damage to be addressed regardless. Okay. Um, so this is just to keep this in mind for yourself and for your dog, your horse, whatever. Okay, I'm gonna say dog for right now. That's just something we're kind of more in tune with right now. Um, if you have an injury, it makes total sense to get the x-rays. Absolute sense. Check it out. See what's going on. You can look for effusion, fluid in the joint. You can look for fractures, anything, okay, related to the joint and the bones, but it's not going to show you the soft tissue. I'm just encouraging you to say, hey, what about the soft tissue? If you have an injury and they say the bones, everything's fine, you didn't break it, your dog didn't break it, your horse doesn't have a fracture, whatever it is, if it was caused by trauma, there's a good chance there was trauma to the soft tissue. So just keep it in mind to address the potential of any soft tissue issues and not just be a bag of bones, because we're not. Okay? Just wanted to share that. And just, if you have any questions, any thoughts, happy to help, happy to answer when I can. Again, I am not a medical professional. I am simply saying this is my experience and that I could have gone down a path I didn't necessarily need to go down right at that moment because we're not a bag of bones, right? Okay. That's all I'm saying. I'm not saying that you should go and be questioning all of your doctors and, I mean, if you have the questions, ask them. And if you think something doesn't ring true, ask someone who might be able to say, well, did you talk about this? Okay. It doesn't, it's your body, it's your dog's body, it's your horse's, your cat's, whatever. This is how you can be an advocate for yourself and for them. All right. Have a wonderful day, everyone, and we will see you again soon. Thanks for joining us.